Welcome to the Chapter 3 overview, Health, Education, Poverty, and the Economy. As we scroll down, I have a few things already highlighted for you. As always, we want to start with the learning objectives. Remember to start here and to come back to these once you go through the chapter to make sure you can address each objective. We'll start off in the introduction, and we're talking about health and economic matters, how much health adds to or takes away from your financial standings. This is carried on page 50. And it talks about, think about economic matters also in health and development. That's development of personally, family, societally. So health, education are connected in three ways. This paragraph walks you through those. Health of parents, malnutrition, down to contributes to the prevention of illness. Okay. Now, these paragraphs go through, and each one has a different way that health is related to education. And I've just highlighted the first sentence in each section. So I'm going to walk you through these and let you see those highlights. And then this last one, the most extensive studies of the links between education and health show that the education of women has a powerful impact on child survival. These are huge numbers. This paragraph, spend time there and look at both the health of the child and child mortality, and how a little difference in education makes such a difference in the health of the child. One of I think the main point here is that education from this vantage is more important than the economic factors. As we continue on, we get into health, productivity, and earnings. And this is health increases longevity. One lives longer, you can make more money if you're in the workforce longer. And then the second one, as you would guess, healthy workers are more productive. And just think about the times you've gone to work not feeling well, gone to school not feeling well, had the flu and didn't do anything, and how much that cost you. And the lower your income, those few days of work missed can have a huge and dramatic impact. So here, the health, the cost of illness, and poverty. The lower income, the poor countries, they're paying for treatment and drugs at a very high percentage of their income. And this is skipped over to the other column and highlighted for you. The cost of illness can be devastating on these poor families. Now we go to the next section, and we're talking about health and equality. There's three views, opinions on this. I've highlighted these for you. You need to be able to put these three together and come up with your own ideas of equality and health. So this is one of those elevator answers, or in a hallway if a conversation comes up. Can you explain health and equality? So make sure you can sort of define this, explain this in your own terms. Next column, we get into some things we want to consider on health and how health equality deals with the bulleted list. And that's from health status, access to services, coverage, protection, the financing is fair, and the distribution of. So see how equality plays into that. And then the next list below that is look at how these factors affect equality. That's being basic geographic distance to, the ability to travel, are health services available, what percentage of personal or country finances pay for health, and then the acceptability. Are females allowed or encouraged for certain treatments? And then the last set of lenses, how equality looks from the socioeconomic status down through social capital. If your group never votes So do you get no health care, or do you have the social capital to push for equal treatment? Okay, the next section, inequality across countries. As you would expect, life expectancy and high income higher. You may not have expected 60% higher. So look at equality across countries, and then we go down and we look at it within countries. And it's not surprising we find countries that are basically the same in the population, Scandinavian countries and other high-income countries. The health data is pretty much the same. When we get into varied countries, then we see quite a bit of difference. We see an example here of life expectancy for a white American male in 06, 75 years, as opposed to a black American male, 69.7. Figure 3.6 examines the extent at which births are attended by a skilled attendant. This is a huge issue, and it's a good way of capturing equality in income. So just think if you had your child born with no personnel there, and what a difference it would make to you to have a trained medical individual. So that's a really good framework to put the equality in income. Okay. We go over to the next page, and we see on 3.7 we look at children who are underweight by income. So let's look at spend some time with that, and it does break it down for you from the poorest to the richest. And you can see a huge difference between the two extremes. Okay, in the equality in gender, huge issue around the world. It's one of my personal concerns. And this statement really sums it up. Being born female is dangerous to your health, especially in low-income countries. Throughout the book and later on in Chapter 7, we'll talk more about this topic. But there is a huge difference between being female in the developed country and the developing countries. And again, we'll get back more onto that in chapter. The next topic is equality and ethnicity. Now, I skipped right down to the third paragraph, and I have noted in my text why. Given the strong association of ethnicity and power, education, income, it's not surprising to find a strong association between ethnicity and health status. Now, for any public health student, I would expect them to be able to explain power, education, and income and how those three things affect health. So make sure that you can do that. Financial fairness. I want to highlight the start of this for you. And really, everything in it comes down to this paragraph. So make sure you can explain why equality and financial fairness. Now, this gets into a lot of personal beliefs, and I ask you to possibly set aside your personal beliefs on some of these things and look at this from a pure public health standpoint, and then add your personal thoughts on financial equality and fairness. Page 58 brings us to the concluding comments on these. Look over the bullets. Make sure you can explain them and how all of these affect equality and health. On the next paragraph, I'm going to highlight one of the critical points in efforts to do this. We emerge partly from concerns of equality to ensure that the poor and other marginalized groups are involved in the design, development, monitoring, and evaluations of such efforts. Now, one of the videos for this chapter is going to talk a lot about this. So as you watch, read this section And as you watch the video, come back to those different lenses that we are studying and viewing equality and health. Health and health expenditures and health outcomes. The reason most countries are concerned about this is because it's expensive. Not only is it expensive, you have to have a healthy workforce, you want a healthy population for many reasons. So 311 showcases gross domestic product and levels of health. And we can see here that as a rule, the more spent, the better the health. But that's not always the case. And these main themes will help explain some of that for you. Now, we see here, having seen what countries spend on health, it is now important to ask what they get for that expenditure. And we see in these 3 bullets that countries spend more money, they get better health. Some countries spend much less money and they get better health. So now we have to think about what's the best way to spend the money. And that's what we're getting into in this section. Let me highlight that for you. This goes on to further explore that and to come up with what is the best way to spend the money. This is further explored in the video, one of the videos for the chapter. If you're given this huge sum of money and you're told to spend it to improve the life of a large number of people, how would you spend it? It's a very interesting video, and it's a great question. The public versus private expenditure sort of operationally defines those for you. So look at that and have a good working definition of public versus private expenditure on health. Now we go to cost effectiveness, and this is how we spend the money. Well, what is the best way to spend money to improve health? So here we're getting into how we measure effectiveness. And we do these through, as we've already talked about, the amount of health that can be purchased. It could be measured in years life saved. And we've talked about this earlier in the last chapter. So I'll highlight that paragraph for you there. And down into this paragraph, it talks about some different approaches. We come over here to talk about not only how much something costs, but which intervention may be better. And there's a great example here, and it goes on to talk about coronary bypass surgery or curing a case of tuberculosis. A very interesting comparison to the same number of years, huge amount of difference in money spent. On page 62, talk about sort of a taste of chapter 8, and we talk about financing and where's the best direction to spend money in. That's sort of introduced there, and then they make sure that you note that not rarely is cost effectiveness the only thing, but the equality, the burden, and the extent of the investment serve society as a whole also come into play when we make these decisions about what to treat and how much money to put toward that. Okay, and this continues on. This continues on page 63. And I'm going to highlight these bullets looking at other cost and cost analysis issues. And it sets the framework for you for the book and how the book uses these different tools and from the perspective the book is written. Health and development. Think of development as societal development, individual development, how healthy that is. I have a note here in the margin about last time you had the flu, how much studying did you get done? How much personal development were you able to do? There's a good example up here about a case of malaria and how a country with strong prevalence of malaria and how it slows the economy. And I'm going to highlight the bottom of the chapters, which also goes in to talk about how health and development, low health, can limit or reverse development in certain countries. We saw this with the fall of the Soviet Union and how life expectancy went down when the Soviet Union fell, and it's just now starting to come back up. Okay, the rest of the chapter is a case study. I'll let you work through that. And then on the next page, we've got main messages. Review that. And you should be able to review this, tie that back to the objectives on the very first of the chapter. And then, while these aren't due for submission, can you answer the study questions? It's not a bad idea to jot these down and write out your answer. Go back in the text and see how your answer compares to the information. You may even try to do this before the chapter, come up with your response, and then once you've gone through the chapter, look at your answer and add to that. Okay, I hope you got your notes for Chapter 3. Good luck on this one, and I will see you at Chapter 4.